this is muscular. We probably should ask Melanie to put hands on first. And so that's how this whole idea got started, was me sharing that this is one of the things I offer. Go ahead. And I think it's really all about quality of life. That's my goal as a physical therapist, is to improve my patient's quality of life. Whatever that is that you're trying to get yourself back to, let's figure out the most logical way to get you there. Oh dear. So my experience is a lot, 22 years, but ironically in PT school we had one lecture and lab on massage. And I left there and happened to go out to dinner that night with my roommate or boyfriend, and he happened to ride his crotch rocket motorcycle to Florida and back from Iowa to a wedding, and he was in a lot of trouble that day when I met him. And I said, I've never tried this before on like a real person, but I'm happy to try this. He had knots all up and down his right arm from running the throttle and being bent over. The guy almost proposed to me by the time the evening was over. We'll just put it that way. So I recognized right away the benefit of deep tissue work for resolving muscular type pain. Then I had the opportunity to work in the headache clinic, which taught me some neat skills how to manage headaches. I worked on neurosurgery for almost a decade, so patients would have major surgeries, come out of it, be in a neck collar, and still our anesthesiology team could not manage their pain with an epidural because it was muscular. And that would be something that I'd recognize, treat it, and the patient was ready to leave the hospital. They would have been in the hospital for days had that not recognized that it was muscular type pain. Worked with outpatient spinal cord injury patients in wheelchairs, so they have overuse type injuries and manage their pain with manual therapy. And I've even had patients who had full cardiac workups undergoing. In fact, one recently where the nurse came in to hand her a nitroglycerin tablet as I explained to her what my skill set was for massage, and we recognized that it was muscular, and she did not need nitroglycerin, and she did not need an EKG. So I became the therapist on the adult bone marrow transplant unit in 2010. And that's when this all really came together, because I probably do 3 to 5 massages a week. And these are the pragmatic type of massages. You tell me it hurts, let me find it, I'll fix it. One session, 2 at the most, and we've got you back in working order. So I'm not staffed in a way to provide you the relaxing type that you might have gotten today, some of you, but that's because I oversee 25 patient beds. So the thing I've learned is that, oh, you guys are all getting a CAT scan right now. We've advanced to the next picture. So that's part of my full disclosure, but what I've learned is that deep tissue or acupressure is the right tool when it's muscular pain. And this is, just so you know, I did receive regular CAT scans while I was preparing this lecture. About every half hour, my cat made sure that, that I was taking breaks. Go ahead. And the other disclosure that I can tell you is that I had to do some of my own in-depth research on the topic. I had 2 massages the week that I was preparing this content for last week. All right, next slide. All right, I'm going to hit you with some boring but important evidence. So these next 3 slides are research articles. The prevalence of symptoms in patients with multiple myeloma. This is a systematic review and meta-analysis. So this is coming out of in the European Journal of Hematology, and they're pulling thousands of papers. Go ahead and click. 34 studies met their inclusion criteria, but that included over 3,000 patients, and the majority of the studies looked at pain, fatigue, and changes in quality of life that had to do with physical or with functioning, with different functional levels in your quality of life. The most common problem with quality of life, their physical function. 99% of the participants reported difficulties there. The most prevalent symptoms were fatigue in almost 99%, pain in 73%, constipation in 65%, and tingling in the hands and feet in 53%. So what can we conclude from this study? Well, there's a heck of a lot of undesirable symptoms that folks are having, symptoms and side effects as a result of treatment for their multiple myeloma, which is negatively affecting the quality of life. I don't think this is a newsflash for you folks, but I just wanted you to know the evidence supports you. Okay, the next study, side effects of analgesia. Analgesia may significantly reduce quality of life in symptomatic multiple myeloma. Everyone in here probably knows analgesia means pain medication, typically a narcotic or referred to as an opioid. This is an article from 2015. It's a cross-sectional study. They did interviews, and there were 21 patients in the study who had symptoms from their multiple myeloma and were also on pain medications. took their medicines for back or bone pain, and some of them for neuropathic pain in their legs. The majority of people interviewed, 17 out of 21, they were using a strong opioid. I don't know if you're familiar with the World Health Organization's classification for opioid or pain management, but there's three steps or three ladders, and 17 out of 21 were at the very top of that, meaning they had a lot of narcotics that were available to them. In fact, most of them had three analgesic medications they were on. However, pain and fatigue continued to be their most pressing symptoms. In 50% of those people, it was neuropathic pain. The most commonly reported side effects: constipation, dizziness, tiredness, and fatigue. And the side effects related to their pain medications, 39% reported those side effects to be severe. And 30. In conclusion, analgesic side effects are a major problem in myeloma management. Oh, fun fact: 80% of the global opioid supply is consumed in the United States of America. Lastly, massage for symptomatic relief in patients with cancer. It's a systematic review, again, where they compile as many articles as they can and compare all the data. 1,325 papers were considered. Only 10 of them met the inclusion criteria. It's going to become apparent to you why this is a problem. So only 428 patients can be sampled for this. The combined results showed that massage might reduce anxiety in patients with cancer in the short term, and it may have a beneficial effect on physical symptoms of cancer, such as pain and nausea. The conclusion really is that there's a lack of rigorous evidence to support massage in cancer patients. Well, I already alluded to that because only 10 trials actually had the structure that they needed to be considered for a systematic review. So basically, further well-designed trials are needed. The one problem with that is, unlike pharmaceutical companies, my pharmacists aren't, motivated by this need to come up with a research article to prove that what they just did was helpful. Their clients come back, and that's proof enough. And one example of a paper that was not included because it did not have a control group was a paper that came out of Memorial Sloan Kettering in New York called Massage Therapy for Symptom Control, an outcome study. They showed an improvement in pain of 40%, fatigue 41%, anxiety 52%, nausea 21%, and depression 31%. But it was not included. Again, it didn't have a control group. In other words, a group of people that might have sat in a room, and I don't know if the control might have been some hands were just laid on them for the same time period, or they were read a story. It'd have to be something that couldn't be confused with the benefits of massage. Go ahead. Can you go back one? So in summary, what do we know thus far from these findings? Pain is a common symptom or side effect from treatment of myeloma. Opioids or narcotic medications are commonly prescribed. They have many unpleasant and often severe side effects, and massage has potential to significantly reduce severity of common symptoms and side effects in the treatment of myeloma. However, we only need better quality of research studies to prove it. So the precautions, I have all your handouts in my backpack. Oops. So I put together a brochure for you to be able to take with you that has all of these precautions and indications listed and the specifics, so you aren't having to take notes or think you have to Google it later. And these are what the next few slides are going to cover. So some of this language, I know you folks are all very well educated on your disease process, but I tried to use some of the terminology as well. Obviously, if you're going to seek massage, you need to know if you have low platelets. It's not so concerning the exact number, but there's a certain categories once you drop below, for example, 50. One of the resources that I found said that you should really only have superficial muscle level massage. Once below 20, they recommend just ultra light skin contact only. Go ahead and if you're obviously if you have very low platelets, it'd be smart to reschedule your appointment just so you don't develop any bruising. But I can tell you my empirical findings is that I have been able to provide gentle but effective massage to the muscle tissue that is definitely more than just ultra light touch to the skin for patients that I've had with platelets anywhere from 10 to 20. Um, I typically, if we transfuse patients with platelets if they drop below 10. So if I see a number below 10 in the morning and I know I need to treat that person, I'm going to wait at least until they have their blood product. But otherwise, I've had no complications whatsoever. Go ahead. Unexplained swelling or blood clots. So this is a concern. It surprised me when I first started on bone marrow in 2010. I thought, oh, I'm not going to see blood clots anymore because these people don't have enough platelets. But that was not the case. I had a couple of folks, usually someone who was a little too short, the chair they were sitting in, they sat for too long with pressure at the back of the thigh that could develop swelling in their legs, ultimately a blood clot in the deep veins of the leg. And also keep in mind, it's very common with travel. You see in your airplane magazines, you're supposed to do your ankle exercises and get up and walk because it is common for people even without a cancer diagnosis to get blood clots from long travel. Even in a car, it could happen. So that's one of the reasons we did not do massage to anybody's legs today because we knew you were all traveling in from a distance. Keep in mind that you can reduce your risk, like I said, by doing exercises and getting up and moving periodically. And just so you know the severity of the situation, if a blood clot did develop in a deep vein in your leg and it was released from where it was nesting, it would go to your lung potentially, and that can be a very serious condition called pulmonary embolism. Okay. Yeah. Oh, yes. Okay. I didn't specifically look at that type of pain for this talk. I can tell you I have a lot of, well, just in the general population, impingement syndrome. If you're speaking of the shoulder, one of the rotator cuff muscles, is that what you were referring to? Well, oh, well, we may need to talk a little bit at some point with more detail about the type. They were okay. So you can have spasm in any of the muscles, even some of the rotator cuff muscles. But the other thing that came to mind is that the supraspinatus muscle is a very small muscle. That's one of the four rotator cuff muscles, and it's the most commonly injured throughout the population. And you're more inclined to injure that muscle if you have faulty posture, meaning forward head, rounded shoulder, that kyphotic posture, which we see a lot of times in folks that have had compression fractures, right? So I would just say that it's possible that this population has a higher rate or incidence of impingement syndrome of the supraspinatus muscle simply because of posture with your rounded. You still got to reach up to that same shelf that you have the cookies on or whatever you're reaching for. Your shoulder blade is anteriorly tipped, and that can actually create a smaller space, and that's where you pinch that tendon between the two bones because of that posture. So a very concerning precaution if you're going in for massage is whether you have any lytic lesions or compression fractures. And this is part of our intake interview today. So there's a few pictures here just to give you an idea. Osteoporosis is something that can happen to us, especially with decreased hormone levels, vitamin D or calcium levels. But lytic lesions are specific to myeloma, and those are tumor-induced weakening of the bone. Go ahead. And this is to give you an idea with compression fractures. Those are of the vertebrae of the spine. And when that happens, it's most commonly in those areas I marked on the left with the two blue squares because of, again, faulty posture. If you're sitting slouched, what is all the forces that are coming from the weight of your head and gravity down through your spine. That force line is falling right on the anterior or front part of the vertebrae, and that's where it weakens and gives. And so that makes those vertebrae wedge and creates that forward rounded curve. We can use pillows and wedge support sometimes, and I've definitely positioned people on their stomach in the hospital on their hospital bed. It's very unlikely that person's going to tolerate laying flat on their stomach. So this is a time to consider if you need to be on your stomach to use wedges or pillows, but otherwise I do a lot of my massages just in a chair, very similar to what you're sitting in. It allows me to get access, and my patients can sit with a good tall posture, so I'm not inducing any more risk to those vertebrae. Implanted devices, so all the different, I listed all kinds of different devices that folks might have in them, but today we had a few people that have a port in their chest. Obviously you don't want any pressure or friction on that in terms of positioning, and certainly no one should be doing massage around that. And all this information is in your handout as well about the details. So today, the interventions that we put forth. This was a collaborative effort. Once I mentioned the idea of massage, Dave Weissel is a believer, and when you say something that you might be able to do, he says, well, heck yeah, you can, and I'm here to support you. So that's how we got to this point of doing this massage intervention today. It was a collaborative effort between physical therapists, meaning myself and Leah Lenz, who's sitting in the back there. She's doing a breakout session today. She is both a physical therapist and a patient who's gone through tandem transplant at the University of Iowa. So we were the physical therapists. We did the medical screening. We interpreted, what's going on with the different lesions, and had to kind of pull some information out of a few of you that were a little less likely. You might say, oh no, I just have multiple myeloma, and we knew that wasn't the end of the discussion. We needed more detail. And then we worked with Coastal Massage. Daphne Moeller is the owner there, and she brought in her therapist Sharon, Joyce, and Ashley Olson. And we had Tony Crawford here from Lomi Massage Amelia. He is also an instructor at Florida State Community College of Jacksonville, and he brought with him some of his top students, Robert, Emily, and Rhaenitria. We provided 33 massages today, and 18 of those were to people with multiple myeloma. And the massage feedback form was completed by all 18 of those participants. All right, so I just tried to capture a little bit of these results, so I apologize if I wasn't very social out there in the tent, because I did all but comps and dissertation, and this is why, because I don't like to do a little bit of data crunching to help us out today. So a few of the topics that you folks answered on, one of them was that we asked these folks to rate on what's called a Likert scale. It's just a straight line, 1 through 5. 1 means strongly agree, 2 is agree, 3 is undecided, 4 you disagree, and 5 you strongly disagree. So for the first question, massage today reduced my stress or anxiety. On average, in those 18 recipients, the score was 1.7, meaning that they agreed that it did reduce their stress and anxiety. Muscular tension was reduced, 1.7 again, so we have a strong agree. Massage today reduced my fatigue, 2.3, again, an agree. For these other 3 questions, so one thing I asked was whether you've received massage while you were an inpatient, and the response there was a 4.3, which is disagree. So the majority of people have not received a massage when they were an inpatient. Have you ever received a massage at the infusion suite? The answer, the mean there was 4.6, so a strongly disagree. People have not seen any signs of somebody to give them a massage there. And lastly, has your oncologist recommended massage in the past? And the response, the mean was 3.9, which is, nope, disagree. For the large part, most people have not had an oncologist recommend massage. Next. So before I reveal what's coming next on this slide, any questions, any thoughts about the massage today that anyone wants to share? I know just in general, we saw smiling faces. We saw people who were moving freely. I think what's really telling is that we had you folks come in, you all, I can tell you when I did the orientation for my folks that were giving the massage today, I had jaws dropping. I had to go around and put people's jaws up and eyes popping out of their heads. What did these people have fractures? These people have lytic lesions. They're everywhere. What, they were quite surprised, and that's our culture right now. Is I think probably 2 decades ago, what I was taught in school is if somebody has a cancer diagnosis, whew, you just kind of steer clear. You don't want to make that any worse. But what we're here to show you today is that you have a cancer diagnosis, you have numerous precautions, but you shouldn't be led to believe that massage is not beneficial for you. And I think if you leave today with this information, you can educate your oncologist, you can educate your massage therapist. There are physical therapists that do massage as well in the outpatient setting, and they're going to have just probably a little bit different vantage point in how they look at you than, say, a massage therapist clinic. They aren't per se trained to do further instruction in exercise or posture and that kind of thing. Yes. Well, I think the first thing you need to do is full disclosure. You need to let them know, as the client coming in, here are my concerns. I have this disease. Here are my, where my lytic lesions are. These are, you can speak lay language and say, this bone is fragile. I don't want you shouldn't do any thrust or pushing on this, or I only tolerate massage if I'm seated because of these reasons. Or don't do this arm because I've had a blood clot in this arm. You need to be your own best advocate. I think the majority of massage therapists, if they're licensed, if that's the skill set you need, it's just a matter of letting them know, even on the front end, because there are certain specialties within massage, right? There's people that do Thai massage, Lomi massage, sports massage, deep tissue, Swedish style. There's a lot of different styles, but many of them are trained in a number of different techniques and styles. Yep. I would say, I mean, in my own experience, I have had Lomi massage, Lomi, which is Polynesian based, popular in Hawaii, and actually that Tony does that practice. That can be a little more aggressive, like involving stretching of your body along with the muscle in ways that probably I would not recommend. Sports massage can also be pretty aggressive. And even the phrase deep tissue, I use the phrase deep tissue because I know I am getting into that muscle and physically breaking up the muscle spasm. But I've had deep tissue work before where I know that if I had myeloma, I probably would have had, rib fractures when I left there. So it really depends on the individual, the depth that you request, and that should be an ongoing conversation during a massage session. Is you give them all the warnings on the front end, and once they start treatment, to give them feedback and say, yeah, actually, oh, could you just back off a little bit there, or that's a little too much, or actually you can push a little bit harder there. That feels good what you're doing. So that communication should be there the whole time. It should never be discouraged on either end. And that meaning that the massage therapist should also be asking periodically if that pressure is working for you. Other questions or thoughts? I realized I didn't, partly because I couldn't really turn my head, but also because the content is within that brochure for you there. The nitty gritty about the precautions, I think those are things that I can bore you with standing up here and talking about, but they are important things for you to have as take home information to have that conversation with your providers. And if there are no other questions, I just want to end by talking a little bit about what I feel Pat Killingsworth brought to us. His saying was, feel good and keep smiling. And what I know about that is that Pat had a great zeal for life. He had a love for so many people and respect for so many people. He also appreciated the evidence. He knew that pets were very, beneficial to your quality of life and loved his fur family. He also, this picture showed up when I did a Google search of Pat Killingsworth. So I I'm assuming that's from when he owned the fitness gym. But he's smiling, as you can see. And Pat's sense of humor, I added the heart strategically after his hip surgery. That was on his blog from 2013. So, in conclusion, I feel like Pat has taught me a lot of things. He's taught us all a lot about the importance of all these things in keeping up our quality of life. And again, I want to thank him and thank you, Patty, for keeping this conference going. And I think I answered all your questions already. So.
From this morning. So what we're going to do is we're just going to take a little 5-minute break so you can get up, stretch your legs. If someone needs to use a restroom, grab a drink or something, and then we're going to come back and we'll explain the breakout sessions, and then we'll send you on your way. So we'll see you in 5.